Namaskar. My name is Dr. Soumen Roy. I am a consultant GI, HPP and liver transplant surgeon in Apollo Hospitals Bhubaneswar. We have started liver transplantation in Apollo Bhubaneswar since last year, and we have been doing LDLT and cadaveric liver transplants. So today I will discuss regarding liver transplant, who the patients and who are the candidates those need liver transplantation, what is liver conditions, liver failure, and also about the transplantation process, what are the documentations and what are the needs and greeds of this, and also post-transplant care. So in the first part we will discuss about liver problems. So in our state and in this India, fatty liver disease are rising, that is metabolic liver disease, and the patients who progress, like those have drinking alcohol, liver cirrhosis they develop, or hepatitis B, hepatitis C, these are the major conditions, and at the end stage if they develop liver failure, those are the patients who need liver transplantation. So liver transplant is a process where one part of liver is given to another patients, that is called as live donor liver transplants, and in cadaver liver transplant, whole of the liver is given to the patients from brain dead donors. So those patients, those are recipient, means those need liver transplantations. They are having actually liver failure. If you see in reports, bilirubin is rising, INR is rising and having bleeding, you have ascites, swelling of the legs, swelling of the abdomen, and requiring multiple albumin transfusions. These patients usually are in lineup and indicated for liver transplantations, because if you don't do transplant, evidence shows the 6 months mortality is very high. So that's why the early stage, if you do transplant, the success is very high. If they have complications, multi-organ failures and multiple decompensations, then the success rate decreases, mortality rises. So the common thing is that once the medications are not beneficial, patient deteriorates, ideally one should come for consultation of liver transplant, because that is the only cure. And in live donor liver transplantations, once you give one part of liver in family member, so like in kidney you do HLA typing and other screening modalities are there, but in liver only blood group matching is there, and multiple tests are there to see the fitness of the donor and the recipient. About CT, we have the software, a lot of process, it takes around 10 days, around 2 days to 10 days for workup. So once both the donor and recipient gets fitted and all those things, formalities are done as per the government guidelines, so they are being lined up for liver transplantations. And if you are having liver failure, like acute liver failure also are very high chance they need liver transplantations if treated very early. And certain liver malignancies, liver cancers, if they are within Milan criteria, certain guidelines are there, so they can also have a good success rate and life survival. 5-year survival is around 80% after liver transplantations, so they have a good survival rate. So these are the cases and the patient's liver conditions, those patients who need liver transplantation. Now I will discuss about the part and the process of liver transplantation. So liver transplantation is a myth that it is a very complicated surgery and success is not there. It is not so. It was there since 10 years back. Now because of so much of advancement in technology, in the infrastructures and the surgeons and the team, the success rate is 95% in early stages. It varies from 90 to 95% depending on the condition of the patients. If they have multiple complications, the success rate decreases. So it's above 90-95% success rate. The patient have a good life, they live longer, except for malignancies. These are benign conditions like alcohol and hepatitis B, they have a good 10-year, 20-year survivals. It is not, and what is the beauty of the liver transplantation is that the liver grows like a normal human being. That is the only organ that grows in the body. So with time the immunosuppressions also medications decreases after 1 year or 6 months. They have only minimal medications, they lead a normal life. We have been having donors and recipients in our hospitals since 1 year, they are having normal living and they have a good success rate. Now coming to the complicated, obviously liver transplant is a complicated procedure. We take care of all the nit and grits, all multimodality departments, CT scan, all the ICU, they need to be in a controlled environment so that they don't have any infections. That increases the success rate. So that's why cost and burden improves after taking care of all the modalities, clinical and administrative modalities regarding liver transplantation. And the point is that in our eastern zone, in our Apollo Bhubaneswar, we have a very cost effective program as compared to the other tier 1 cities. So we have a great niche here. We have been the good team. Dr. Nirav Goyal from Apollo Delhi, we have the team, and myself, we do the liver transplantation here. So we have a good success rate. And after the transplant, we take care of the patients in the selected ICU, that is dedicated ICU, where they need a dedicated staff, dedicated team, dedicated hepatologist, pathologist, radiologist also. So that adds to the success rate of this department and this hospital. And after 1 week or so, after 3-4 days, the patients can be transferred to the ward. The donor is transferred to the ward after 48 hours, and within 7 days our donor have been discharged and they lead a normal life. And recipient also can be discharged after 2 weeks. Some takes around 14 days or some takes around 70 days, depend on the conditions. And then after that, the important part comes the post-transplant care. So what happens because initial days, initial years, people used to go outside because to do transplantation, no doubt they have a good team, but they have to stay for months near the hospital in another state, that adds to the cost, burden to the family, resources and also difficulties. Here in our eastern zone, for Odisha people, you have to stay nearby the hospitals for first 15 days. The reason is that you need to monitor your liver test, that immunosuppression level regularly, and once you are on immunosuppressions, you are on age, small infection can be catastrophic for the life. That's why we take proper care. Home care services are there. We do proper consultations daily basis, and then after 1 month or 15 days of the transplantation, patient can go home to their village. So they should have a separate house, separate cleaning things. So it is not only about the medical things or the finances or the resources. Patients, family support, family member psychosocial support is very important. Preparing for liver transplantation, it takes time, it takes mental strength to prepare for liver transplant, and also to tide over the duration of your liver transplantation and after transplantation also. So post-transplant care, usually in liver, the beauty is that liver has a immunomodulation activity. So the immunosuppression medications, they decrease over time, and the medications very minimal after 1 to 2 months, and we are having our past patients coming monthly once for checkup. So it is like a routine surgeries for all those cardiac bypass surgeries or any kidney transplantations initially. Now routinely in every city transplant has been done. And we are very proud of this Apollo Bhubaneswar that since 2024 we have been doing successful liver transplantations, and both live and cadaver. Coming to the cadaver liver transplant, it is a different, full organ is given because of the support of the Odisha government and other ICU staff and other support system. If any unfortunate, any brain dead patient happens, if the patient are willing to donate their organs, after full consent and legal formalities, we take them for transplantation organ like kidney. One life can give 2 kidneys, 1 liver, heart, lungs. So 1 life can save 5 lives. So it is a very important message to the public that organ donation should be promoted. A lot of patients, we have thousands of patients waiting for kidney transplantation and hundreds of patients waiting for liver transplantation. They are dying of liver failure. Not everybody has a live donor in their family. Sometimes blood group doesn't match. So cadaver liver transplant is a very good initiative. Organ donation is a very good initiative for the people. One should pledge for organ donation. In that, full organ is transplanted to the patients, and we have been doing transplantation here in Apollo Bhubaneswar. So one should take care of the liver. In the end, what I should give message to the public, that one should take care of the liver. In liver test, nothing is very specific. Even if you are having liver failure, the liver LFT reports may sound normal, and if you are initial stages of the disease, the liver reports may be very abnormal. So you should have an annual healthy checkup of your liver 6 monthly, and you should sometimes, those who are having fatty liver and alcoholic, they should do fibroscans, and one should consult where the criteria of liver transplantation fits in. The early you fit into the criteria, the best is the success rate of liver transplantation. But again, you have to judge whether medicines is needed or transplantation is needed. That is a multi-team approach for the hepatologist and a transplant surgeon. Both work in hand along with that full course of treatment. So that makes the success of a liver transplantation program. Thank you.